I think one of the great things that ANA, American Nephrology Nurses Association, is known for is our education. And so that's often the first thing I hear people talk about, but really the more I've learned about the organization and being part of it, it's really an investment in ourselves as nurses, as well as in our patients. There's so much that you can gain from being a member related to the membership, the mentorship, professional development, getting to meet people from all over the country, sometimes in other countries, even online. If you have a question and you need an answer and there's nobody at your institution who can help you, you've got this great network that you can reach out to. So I really think of it as an investment in yourself. As always, attendees can expect amazing education. Our planning committee likes to happily surprise me every single time with the variety of educational opportunities, whether you're in direct care, administration, advanced practice, you can find something. There's something for transplant, there's something for pediatrics, there's things that are about self-care or professional development. So there's a huge line of opportunities there, and you can join in virtually or in person. But if you happen to be coming in person, there are a lot of extra activities that you can join in on. And so on the 15th, we have a movie night where we're going to be seeing a documentary called Nurses Unseen from an award-winning director who talks about the history of Filipino nurses in the United States, as well as a lot of the efforts that were done during the pandemic. We also have a networking session with a recording producer and kidney patient advocate one night as a cocktail reception. And then he's actually speaking as our closing speaker, talking about his experience doing home dialysis and then having a transplant. So there's going to be a lot of fun in addition to learning at this event. So workforce is a major issue for all of nursing, and especially for nephrology nursing and any of the more little known specialties. ANA is helping support people with that, partly by increasing and elevating nephrology awareness of nephrology nursing. And so we're actually partnering with Carolyn Jones, who is an award-winning director of the American Nurse Project, and she is creating a short film about nephrology nursing that we're going to launch next year in 2025. So that's one way that ANA is trying to elevate and increase nephrology nursing. We're also having multiple partnerships with other nephrology nursing chief nursing officers and the American Society of Nephrology to talk about workforce and how we can support each other and our whole community so that our patients will have enough providers to take care of them. So these are some of the ways that ANA is supporting our workforce, as well as advocating. Can't forget about advocating. We do go and have Hill Days where we try to support nursing legislation to support nursing safety and education and workplace environment, as well as our patients, so that they get screening and access to novel therapies. So there's a broad range of things that we're trying to work on to make the challenges more manageable. I think it would be great to go and talk to a nephrology nurse or reach out to myself or anyone on ANA's board and talk about what it is that we love. I talk about how I became an accidental nephrology nurse. I went into nephrology by chance, and that was almost 30 years ago. And I have stayed not by chance, I've stayed as a choice because I love the teams I work with and the patients I've been able to work with. And there's so many subspecialties that I've been able to do different jobs in nephrology in different parts of my life with how it worked with my family and what I was interested in as far as professional development. And it's been a really fulfilling line of work. So the one thing is talk to nephrology nurses, come and see if you can have a visit at a center, either an inpatient or outpatient. Check out our website. There's a lot of material specifically for members, but there's also things that are publicly available so you can read up. We have some video shorts from about different nephrology nurses and how they got into nephrology, came in as technicians or from other specialties. So, talk to us. We'd love to hear from you.